Well, good morning, everyone. Morning. I'm John Mann, Director of Education for Lakeside. And for today is our first presentation, which is sponsored by the Jacob Neese First Responder Education Endowment Fund. And this endowment will sponsor educational programs concerning safety, first responders, veterans, post-traumatic stress disorder, organ transplant, and other related topics. But before we get any farther, I'd like to give a moment for the family for Deb Anderson to say a few remarks.
Thank you, everyone, so much. Paul and I appreciate you being here, and we know Jake appreciates you being here. Jake grew up in Lakeside, learned to ride his two-wheeler in Lakeside, learned to eat donuts and ice cream in Lakeside. Many of you knew him here. He interned here in the security division when he was in college. I do have to give a special thanks to Don Leffler, who organized this whole thing a few days after Jake passed away. Thank you, Don. So exactly 1 year ago today, Jake had his organ transplant surgeries at Life Bank in Cleveland. He donated 5 organs, 1 kidney, and also 608 tissue donations. It is, yeah. It is beyond amazing what they can do. It's a conversation, it's hard to have, but you need to have it because you just never know when that phone's gonna ring and you might need to know this information. So we are huge supporters of organ donation. We have heard from all of his recipients. They're all thriving, including a little 2-year-old who got a small segment of his liver, who is just amazing. So please consider organ donation, and thank you again for coming, and we'd be happy to talk with any of you about it if you want to meet with us at any time. We're here a lot. Thank you, and thank you to Dr. Modlin.
Thank you very much. And then for today, Dr. Charles Modlin will be joining us for this inaugural presentation. Dr. Modlin will speak on his life and career as a kidney transplant surgeon and as an advocate for the underserved population seeking transplants. I would ask you to please mute your cell phone ringers and help me in welcoming Dr. Charles Modlin.
Thank you, Will. Thank you again. So can everybody hear me okay? Yeah, thank you. So, forgive me if I get emotional, and, during my presentation, I'll try not to. But, my being here after hearing, your story, and it just makes it all the more special to me, having been able to come out here and speak to this group. I wanted to, just express my emotions about the importance of organ donation and the family making a decision. I know that wasn't a very easy thing to do, but it really resulted in saving countless numbers of lives. So thank you for that. So again, my name is Dr. Charles Modlin. I am actually proud to be here. I spent about 28 years at Cleveland Clinic. I came in 1993 as a kidney transplant fellow. I was supposed to be in Cleveland for 2 years. I'm here, 31 years now, but so I had a number of leadership positions at Cleveland Clinic, but one of which I'm most proud of is starting what was called the Cleveland Clinic Minority Men's Health Fair. I see Dr. Charles Yost and Barbara in the audience. Actually, they helped out at that health fair. It was an opportunity for us to provide free preventative health screenings, especially for black men who have the highest incidence of health disparities. So about 2.5, 3 years ago, I moved over to Metro Health, which is a safety net hospital, where I have more time to dedicate to my community outreach and service to the underserved. That's my contact information if anybody wants to contact me. I'm sure you have the information here as well. I'm VP, Chief Health Equity Officer, so I innovate a number of programs throughout the health system in all the different specialty areas at Metro Health, and not just limited to the area of transplantation and urology. So I'm also the author of a success navigation book. It's called Yes, You Can Succeed. It Isn't Difficult to Do It If You Know How to Do It. And it sounds kind of like a strange title, but there's a quick story that goes behind that. So my middle daughter, Hannah, she was about 3.5 years old. We had a nanny at the time, and Hannah was playing a busy video game. And the nanny was watching her play the video game, and she goes, "Hannah, that looks very difficult to do. Is it difficult to do it?" And Hannah, 3.5-year-old baby, said, "It isn't difficult to do it if you know how to do it." And that makes kind of sense. If you know how to do something, it's going to be, or if you're trained, or if you speak to somebody, you seek a mentor, you consult, and ship with somebody who is already where you want to go in life. I mean, your success journey is going to be a little bit easier. So I remembered what she said, and then some 20-some years later, I made it into my book title. So you recognize any of the background there? So I don't know what year. I'd have to go back and see what years this was, but we spent a number of summers out here. We didn't spend the whole summer. We'd rent a house for about a week or 10 days, several years in a row. You can see how young I look, so it was several years ago. So my son wasn't in the picture. He was actually out taking sailing classes that day. So I do remember I considered myself a sailor. I really shouldn't have. I took my oldest daughter out sailing out here in Lakeside. We capsized. So that was the last time I ever went sailing. So here are some more pictures from Lakeside. That's Sarah and Hannah. And then down in the right corner, that's Meredith. She yelled at me because she wants to be called Laney now. Her middle name's Elaine. So yeah, we had a lot of fun times out here at Lakeside. So this is my family at Church of the Savior in Cleveland Heights. I'm sure many of you probably have been there. Reverend Yost was my senior pastor. And that was a little playground. Actually, there was a huge addition under Dr. Yost's leadership. So that area no longer exists. It's a big addition to the church now. And then there's my 4 kids up in the sanctuary of the church. Many of them have been acolytes and participated in the music programming, etc. My son is an usher periodically now at the church also. So I wanted to, tell you a little bit about my kids. So Trey, Charles III, he graduated from Texas Tech, exercise sports sciences degree. He went into physical therapy. And then, he started seeing patients. He felt that really wasn't the best career for him, so he pivoted and he became a radio producer and radio announcer. If anybody likes sports, he has a sports talk show on WOVU Radio 95.9 every Tuesday from 6 to 7, every Saturday from noon to 1. I always tell everybody, download the app. You can listen to some great sports talk. But yeah, he's my oldest son. He's 31 years old now. My oldest daughter, Sarah, she actually runs marathons now. She has her goal is to run all 50 states. About a month ago, she invited us up to watch her run the Anchorage, Alaska marathon. And it's hard even as an observer. You have to walk around and try to find places, where they're going to be. I got smart up in Alaska, and I grabbed Ubers so I can go around to. I remember when I was in Chicago, I walked like 25,000 steps trying to, But so I got smart. But yeah, I think she's hit about 18 or 20 states thus far. So we're very proud of her. So my daughter Hannah just graduated from Cleveland State with a chemical engineering degree. I was a chemistry major in college, but I wouldn't even attempt to do something like that. So we're very proud of her. As I said, Meredith graduated. She went to Northwestern, which is my alma mater, for 1 year. She said she didn't like it, so she transferred. It didn't make me too happy that she transferred to Haverford, which is a great college in Philadelphia. And now she works at Sherwin-Williams in computer engineering. So yeah, she's doing great also. Back on April the 8th, do you remember what happened on April the 8th? The eclipse. So on April the 8th, she eloped. Down in Akron at Stan Hewitt. So I don't know why she couldn't have told us, but anyway. She saved us some money. I guess I got to look at it, you know. But that's Daniel, her husband. He's starting medical school, I think, this month, down in Rootstown. So I did a lot of so I went to undergrad at Northwestern Med School at Northwestern. I did my internship and residency at NYU, which included rotating at Bellevue Hospital, which actually is the oldest hospital in America. These are some of the things that I like to do. I consider myself a gardener. I grow tomatoes in the summer. I love eating deep dish Chicago pizza. Has anybody ever had deep dish Chicago? That's the best. And I enjoy time spending on the Great Lakes. Obviously Lake Erie, but I like going to Lake Michigan in the summer, about 3 or 4 days. You ever heard of Saugatuck? Anybody? Saugatuck, Michigan? Yeah, that's a wonderful place. So I love music. These are some of my favorite singers. Whitney Houston, Natalie Cole, Barbra Streisand, Burt Bacharach. I loved his music also. I always wanted to try to emulate. If I had not gone into medicine, I considered a career as a trumpet player. I still play trumpet in the Shaker Community Band. We have a concert next Wednesday, 7 p.m. in the new Shaker Van Aken District. I was All-State in Indiana. I'm the last chair now. So, but like I said, if I had not gone into medicine, I would have loved to play trumpet in a Broadway pit orchestra. These are some of my favorite musicals. Wicked, I really love. Cats, Phantom of the Opera. When I graduated high school, I received several offers to play trumpet on several European tours, jazz bands, symphonic bands, but my family wasn't able to afford it. Actually, back then, the cost was $700 to spend 10 to 14 days in Europe. Could you imagine? Yeah. You know, it'd be probably $7,000 now. But so I remember I wasn't able to go because I had to stay and work to make money for college. Some 40 years later, I remember telling my family, my kids, about the story. And so my oldest daughter, Sarah, she graduated from William & Mary in Williamsburg, Virginia. She was in their wind ensemble, and they took a European tour. And without me knowing, she asked the conductor if I could actually play along in the symphonic wind ensemble on their European tour. So this was me playing alongside them in London. Actually, it was the weekend that Meghan Markle and Harry were married. So yeah, that was a remarkable opportunity. So I'm very grateful for Sarah for that opportunity. So any talk I give, I want to acknowledge that I wouldn't be here. Any successes I've had are due to my parents, Charles and Grace Modlin, from Newcastle, Indiana. Remarkable individuals. My father, again, I can never really fill either one of their shoes. My father was a national senior Olympian. He's 80 years old, either 80 or 81 years old in this picture. And he's wearing 4 gold medals for track and field for men over 80. Not only gold medals, he set national senior games records for of the 100-meter, 200, 400, and the long jump for men over the age of 80. So, remarkable individual. This is him doing the long jump. I probably couldn't even jump half of that, without hurting myself. So this was a picture in Palo Alto, California. This was his last competition. My mother actually became a school teacher at the age of 40, went on to get her master's degree. Elementary school teacher. She was the first black school teacher in the history of Henry County, Indiana. So I'm very grateful for her contributions also. This was at her graduation. I don't know if you see that little skinny little kid. That was me back then. And yeah, that was at her master's graduation, I believe, Ball State University. So this is the first house where I grew up, and the reason I show this, interestingly, about a month ago, I was down in Indiana, and a lot of times when I would go down there, I would drive pictures. I was outside this house taking pictures, and the owner walked out. What are you? I was thinking he was going to yell at me for taking pictures. He actually invited me into the house. I hadn't been in that house since 1970. So it was really surreal to be able to go back into my, one of my childhood homes. These are the elementary schools where I went to. Actually, the Riley School, I went to 5th and 6th grade. They actually dedicated a track in the name of my father called the Maudlin Mile. So these are some of the jobs I had. I worked in the cornfields, fried chicken, did a number of things. My father had me working in the foundry. He wanted to impress upon me the importance of gaining, one's education. He actually never had the opportunity to finish high school. He had to leave high school in 11th grade to go into World War II to enlist in the Navy. So both my parents stressed education. So I wanted to, I'm going to get into organ donation and transplantation, but I wanted to highlight an incident that occurred that tells me that I'm doing the right thing in life. Sometimes we don't know if we're on the right trajectory, if we're making an impact on the community. So I'm a urologist also, and one condition that I diagnose and treat is prostate cancer. I was at Cleveland Clinic in February 2003. I had 2 operations, for men with prostate cancer. It's called a radical prostatectomy. And my mother actually was down in Indiana. She was a very severe diabetic. She was on dialysis. And I'd been down there to visit her about a week before. And she had to undergo an lower extremity amputation. And the following week, she was scheduled to have another amputation, because of the diabetes. And when I left her, I said, I have to go back to Cleveland. I have to go back to work, take care of the kids. And I would always give her a hug, pat her on the head. And I said, I'll be back. And she goes, don't worry about me. I'll be fine. She goes, go take care of your kids. So 5 days later, I was doing this surgery. It was on a Wednesday. I get a call. She's up in the ICU. I get a call from the hospital saying that she had a cardiac arrest. And I said, listen, I told the doctor, they had called into the operating room. I said, I can cancel my second case and drive down there. It'd take me 4 or 5 hours. He said, no, we've resuscitated her. She's stable. Her vitals are stable. So I went on to start my second case. I get a call about 3:20 or so that she had actually had another heart attack, passed away. And I was kicking myself for not having canceled that case, driving down to Indiana to see her. I thought maybe if I'd been at her bedside, I could have seen something on the EKG that would have alerted the doctors and nurses. So I was really distraught. So I was planning to go down, prepare, her services, arrangements the next day. So I'm lying in bed at our home in Shaker, and I looked over at the bedside clock, the electric clock, and I heard a chiming downstairs on this clock on the wall. And I couldn't understand because that clock had not been wound probably for 6 months, had not been functional. For 6 months, that's a clock that you have to have 2 keys to wind up to have it function. And the kids were this tall, they couldn't have done it. You know, my wife didn't do it. So I walked down the stairs, that clock was still ticking, but the hands on the clock said 3:02. That's when she died. She died at 3:02. So that told me, and I truly believe this, that told me her spirit came through that clock to tell me that she was okay. Yep. You know, that I did the right thing by taking care of those patients, and you know, that I was doing the life's work that I was put on earth to do. So I get a little emotional talking about that. But to me, you know, that tells me that I'm doing what my parents had wanted me to do. So this actually is one of the things that motivates me. Dr. Martin Luther King, he said our lives begin to end the day we become silent about things that matter. Well, to me, addressing and eliminating healthcare disparities is very important to me and also to society and to especially underserved populations. So elimination of health disparities matters. So health disparities are a higher incidence of disease and poorer outcomes, predominantly that are experienced by minority populations. So of all forms of inequity and injustice in healthcare is the most shocking and the most inhumane. So I was very moved and motivated by Dr. King's statements. I talked about having established the Minority Men's Health Fair. But what I wanted to do is touch on what has been my major career path, and that's being a kidney transplant surgeon, but also advocating for organ donation, because quite honestly, there are not enough organs to go around to meet the needs for those who are awaiting kidney transplants. And you know, when we talk about organ donation and transplantation, we're referring to liver, heart, lung, small bowel, pancreas, and tissue donations as well. So, I forgot to say, you like that hair? I thought about maybe bringing a wig. Maybe that's the only way I can get hair like that again. But so when you look at the incidence of kidney disease, especially in African American populations, 4 times to 6 times greater incidence. And the etiology of most cases of kidney disease are high blood pressure and diabetes, or a combination thereof. You look at the number of individuals, and this number goes up all, yearly. There's actually about 120,000 individuals on the kidney transplant waiting list. African Americans represent about 12% of the population, but represent a third of those who are actually on the kidney transplant waiting list. The best solution, organ donation obviously is something that we need more of, but the best solution for this problem is to advocate for prevention. And so we as physicians have a role and responsibility in terms of helping the community prevent the onset of kidney disease in the first place, and that's prevention or control of high blood pressure, diabetes predominantly. There are some hereditary diseases. I should have warned, I'm going to show some pictures here. I don't know if anybody gets queasy seeing, graphic pictures. Just, turn away, apologize for that. These are, there's different techniques, whereby we as transplant surgeons perform kidney transplants. Are these okay for you guys to see these? Okay. Yeah, I apologize. These are donor kidneys from a small 6-year-old, in which we actually place both kidneys into the recipient, and then over a period of time they grow to about 70 or 80% the size of an adult kidney. And these are advanced techniques whereby historically a lot of these organs have been discarded and not utilized. But we perfected a number of surgical techniques where we could actually utilize kidneys that historically would be discarded. We do know that individuals who receive organs from living donors have better outcomes compared to those who receive deceased donor kidneys. And we do know that African Americans who receive deceased donor kidneys, the grafts, the kidneys don't survive as long. But we do know that if African Americans can receive living donor kidneys, they can have equivalent outcomes as their Caucasian American counterparts. And I say this because we need to educate the black community about the importance of not only organ donation, but living kidney donation as well. So I'm not going to go ahead and show, we have, actually I might be able to show a few seconds of this if it works. Let me see. One thing that one of my objectives is to, as I said, encourage individuals about the importance of organ donation, but one way in which to do that is to let them see how high-profile community leaders also support organ donation so they can understand how important it is. So, let me see, is this...
Saving a life is so important. It means so much not only to those persons who are the donors, but who are the recipients also.
Jesus performed the first transplant in the Garden of Eden when he took a rib from the man and placed it in the woman, and she became a living person.
Think of living. It's giving life back, and it's giving hope.
Donate and live.
So we had... Hi, my name is Dr. Charles Modlin. I'm a kidney transplant surgeon and urologist at Cleveland Clinic. African Americans are at greater risk for developing kidney disease. In fact, African Americans develop kidney disease and kidney failure about 4 to 6 times more readily than other Americans. African Americans have a greater need to receive a kidney transplant. I'm here this evening at a community gala, and what we're here doing this evening is speaking to many community thought leaders about their opinions and attitudes about the importance of organ donation and acceptance of organ donation in the black community. Do you support organ donation?
I do support it, and I also think that former Congresswoman Stephanie Tubbs Jones perhaps expressed it best. If we don't take care of our own, who will? And so it's important for us in our community to remember the number of people who could benefit from organ donations. And you know, our life keeps going and living by giving. And that's the most important part of it.
Well, I support organ donation and any and all other opportunities to advance the progress of medicine in our community and in other communities.
I'm an organ donor. On my driver's license it says that because I know someone personally who saved about 15 lives, and that was Stephanie Tubbs Jones. When she passed, so as soon as she passed away, I immediately became an organ donor. And it's just amazing when you hear about the stories that someone's life is saved because someone was generous enough upon their passing to give an organ.
I definitely support organ donation. As you said, it's a real challenge in the minority community. We need to give, and I think we can help save lives, and that's what it's all about.
My sister was an organ donor. She donated bone marrow to a woman in Baltimore, Maryland, and she extended her life by 2 years. And when she did ultimately pass away, her daughters sent my sister a gold chain that their mother wore and thanked her because she was able to see her youngest child graduate from high school. So when you have stories like that, you can't think of anything but to donate organs.
Organ donation has, as you know, can extend life, can save lives, and there has to be a match, I imagine, in having African Americans who are donors will allow for more African Americans who are recipients of those organs to be able to survive.
We have to learn how to save ourselves, and one of the best ways is to support organ donation. I'm Bishop Tony Minor, and you have my 100% support.
We need to be having workshops and
So yeah, that's just one initiative that we're trying to do to encourage, you know, the black community in particular to become organ donors. So this is an interesting, so the gentleman on the right, I did a kidney transplant several years ago. He was a police officer down in the Bahamas. And his donor was a pediatrician in the Bahamas. They actually flew up to Cleveland for that organ transplant. So they did a story in the news about their transplant. This is another story that was done. And again, it's important that we work with the media to get the word out about the importance of organ donation and transplantation. So. You know, this is when we talk about kidney transplantation, not everybody understands how it's done. This is just a cartoon schematic. You can see up at the top we normally have 2 kidneys. We call it down in the retroperitoneal space. But when we perform a kidney transplant, we usually put the transplant down in the pelvis. And we hook up the artery, the vein, the ureter. So that's just kind of a schematic diagram how it's done. Nowadays, most living donors, the kidneys are procured through laparoscopic or robotic surgical techniques, so we don't have to make those big incisions like we did in past years. The reason why I tell people this is because there are some potential living donors who are deterred from wanting to donate, thinking they're going to have to get a big, painful incision, and that's not really the case. So there are a lot of innovations in the way in which we do this to make post-operative recovery, for the donors also, easier. In many situations, the donors go home in 1 or 2 days after the surgery. So, again, that's just another close-up. This is a kidney, and again, I apologize. I should have forewarned. Just look away if it. So this is a kidney that we actually operate on the kidney for, about an hour or so before we actually go to put it in. That's the artery, the vein. This is a kidney that actually is implanted in the recipient. And as I said, there are several techniques that we innovated at Cleveland Clinic to utilize kidneys that were previously discarded. Kidneys from, unfortunately, there are children who pass away. Kidneys with multiple arteries, renal artery aneurysms. Kidneys from older donors historically were not deemed to be acceptable. But sometimes if, and I hate to say an older donor, because I'm 63 years old, somebody older, 65, I'm considered old now, so. But sometimes we'll put in 2 kidneys from these individuals. See, this is, let's see. Yeah, that video doesn't play, that's fine. So we've actually published in the academic literature our surgical techniques that we advanced at Cleveland Clinic. This is me holding a kidney with a perfusion defect. So there are some kidneys that are not usable because of the vascular circulation is compromised. And these are techniques that we've innovated to be able to use kidneys that have multiple arteries. Most kidneys have 1 artery, but if there's more than 1 artery, we'll conjoin them or do a end-to-side implantation so we can actually utilize those kidneys. And these are just some of the surgical techniques that we published on. That's an intraoperative end-to-side anastomosis of a kidney that had multiple arteries. Kidney had 2 equally sized arteries, so what I did, I conjoined them together. That's the finished product right there before we implanted it. You can see that. Let me see. We are conjoining the 2 arteries. They're running 6/0 Proline. And this is exactly how we like it, as the music says. So you can't hear it in the background. There's a song called "That's the Way I Like It." I think it was Casey and the Sunshine Band. So that's why I said that. That's exactly how we like it. Yeah. So these are kidneys with multiple arteries. Let's see. Yeah, these don't all play, but. So as I said, sometimes we'll put both kidneys from 1 donor into the same recipient. And these techniques actually have allowed us to perform more transplants, get more people off the kidney waiting list. Generally there's, like I said, about 120,000 individuals waiting for a kidney transplant. There's only about 25,000 or 30 kidney transplants performed per year. The average waiting time could be 5 years or longer. The longest waiting time of an individual that I transplanted was 17 and a half years. This lady waited on the waiting list. And it's hard to be on dialysis that long. This is just a CT scan of both kidneys several months after the transplant. You can see both kidneys transplanted alongside down in the pelvis. Again, we've published on these techniques, the pediatric kidneys. Yeah, this is... Good. Okay, we're just finished our pediatric en-bloc kidney from an 18-month-old donor. Kidneys were about 6.5, 7 centimeters in length. You can see the conjoined ureter to the bladder. Excellent perfusion throughout the kidneys. You can see the nice pulse in the donor aorta. We've seen diuresis here. He's going to have an excellent outcome, we believe. You can see how small those kidneys are compared to the size of my index finger. So, it's taking a video. Yeah, go ahead and push the round button. So these stay recorded. It's staying recorded, yeah, it's going. We have a pediatric en-bloc kidney. You can see both kidneys. Point to the donor vena cava, and the donor aorta right there. We haven't done the ureters yet, but we have nice, well-perfused kidneys. So this is a kidney actually that was imported from Indiana. The entire, well, about 80% of the capsule had been denuded. And in most situations, most transplant surgeons would have actually just thrown this out or discarded it. But we actually came up, at the time, this is not, was not planned out. We used a Vicryl mesh, which is like a material that we use to repair hernias. And we created a new capsule, and we were able to salvage this kidney and implant it and get the patient off of dialysis. So this is that kidney once it's implanted. Like I said, some of these videos don't work, that's fine. So this is a patient, a donor who was undergoing an evaluation to donate a living kidney, and we found a renal artery aneurysm. We were able to go ahead and procure that kidney and then repair that aneurysm and implant it into the recipient, getting them off of dialysis also. That's the picture of the aneurysm that was excised and then anastomosed and repaired. So I wanted to leave time for any questions anybody might have. Again, kidney disease and need for kidney transplantation is not something that you commonly hear on TV or people talk about, but it's an increasing problem. The incidence of diabetes, hypertension is actually going up even in our young children. And so all of you, and I think one reason why I'm honored to actually have been able to be here today is to relate the fact that each and every one of you don't have to be a physician, an RN, a healthcare provider to actually help advance knowledge and awareness about the importance of organ and tissue donation. Just becoming aware of what the problem is. You can go out and encourage others. And again, this is a personal decision. We're not here to twist arms or coerce anybody into becoming an organ donor. One of the first places people generally hear about the option of becoming an organ donor is when you go to get your driver's license. But a number of people are leery or suspicious or nervous about signing that organ donor card because they think that if they're in an accident, if they have to go to the OR or the ICU, that doctors and nurses are going to let you die just so they can procure your organs. That doesn't happen. Actually, I've done focus groups, and we say, well, what are the challenges? What are your feelings about organ and tissue donation? One of the first responses, and I have videos of this, is that they let you die. That's not the case, and so it's important to note, and you worked with LifeBank, it's important to note that the individuals from LifeBank who actually go out and talk to families about organ and tissue donation, that's a separate team. They're they're not part of the surgical transplantation team. You know, so there's no conflict of interest or anything like that. It's set up intentionally, you know, this way. And nobody's, you know, whether you sign that organ donor list or not, nobody, no physician, no nurse is going to allow anybody to die to get their organs. And you know, so, but it's people like you who can actually go out and help spread the word about the importance of organ and tissue donation. Again, you know, one donor can save countless numbers of lives. I forget how many, you said, how many people received tissue? 608 individuals, wow. That's remarkable. So, but I wanted to leave some time for any questions that anybody might have. Looks like there's some questions in the back. Yes.
Thanks very much for your presentation. I was wondering about the role of anti-rejection medications related to the kidney transplant.
Yeah, I didn't mention that, and that's very important. So when you can get a kidney transplant from a relative, you're going to have a better match in general than from a unrelated or non-related donor, even whether it's a living donor or deceased donor. And the closer the match, the better outcomes you're going to have, because we're putting in foreign tissue into a recipient, and your body recognizes it as foreign. You know, we call it an allograft, you know, a tissue other than its own. And the natural response is for the body to mount an immune response, you know, just like an infection. And so we have to administer very potent, powerful, we call them immunosuppressive anti-rejection medications that actually can have potential side effects. They suppress your immune system and make you more susceptible to infections. Over the long term, transplant recipients can be more susceptible to certain types of cancers as well by having their immune system suppressed. You know, the immune system fights off cancer as well. But there have been many refinements since I trained in transplantation. We used to keep people in the hospital for three weeks after a kidney transplant. Now they go home 3 to 5 days. And a lot of that's because the medications are less toxic now. People experience fewer complications from those anti-rejection medications. Those medications are also very expensive. And there are some insurances that actually don't cover these medications past 3 months. So that's another challenge that many individuals have. I took a mission trip over to Nigeria, Lagos, back in 2015. I was supposed to do, you know, 2 kidney transplants. What happened was I wasn't able to do it because they had given a blood transfusion to those individuals. They developed antibodies. They were incompatible. But what I learned was the average survival of a person in Nigeria who goes on dialysis is 3 months. And that's not even people who get kidney transplants. Very few get kidney transplants. But it's 3 months because their governmental health insurance only pays for 3 months of dialysis, and after that, they kick it off. So, you know, we're very fortunate in this country that we have the health care services that we have. But, you know, one of my major missions is to advocate for universal health insurance. I mean, everybody, I think, has a right to quality medical care, regardless, you know, of their socioeconomic status. So, yeah, that's something I think that we need to push all elected officials, you know, no matter who they are, to advocate for. Yeah.
For those who are cancer survivors, what is the indication to be a donor?
So yeah, that's a good question. So it really depends on what type of cancer that individual had. And even, so there are some individuals who have had cancer and need an organ donation also, or who need to receive a kidney, liver, whatever it is. It depends on the type of cancer that individual has in terms of when they would qualify to receive a transplant. But as far as somebody being a donor, that holds true also. They have to show that they have a 5-year cancer-free survival. They have to, you know, I didn't mention anybody who wishes to be a living donor has to be evaluated just as stringently as the potential recipient, because we're not going to take any risk at all. For example, taking one healthy kidney out of an individual who then we don't want to put them in a situation where they're going to need a kidney themselves. That actually has occurred very rarely, and if that does occur, if somebody has donated an organ and they need a kidney themselves, then they actually get put at the top of the list, the waiting list. So yeah, there are actually nowadays where individuals who even have had hepatitis C, HIV, even in certain situations, can actually donate to recipients. Depends on how grave the situation is, for them for their need to receive a kidney, liver, whatever it is. We can actually individuals can donate across blood types also in certain situations now as well. So yeah, there have been a lot of innovations, in the field of organ donation, transplantation, immunosuppression that are allowing more people to be transplanted. But still, there's a tremendous shortage of organs. So and again, prevention is really the key. Yeah.
Dr. Maudlin,
Yes.
thank you so much for your presentation. First, I want to thank Deb and Paul for your courage. You've given me the charge to say, if this does happen in my family, I must. Right. What's the percentage of live donor kidney donations versus deceased?
Yeah. So it's probably up to about 20%, I would say. But actually in the black community, it's much lower. It's probably only about 9 or 10%. Because not everybody understands, the option. A number of individuals in the black community who would be prospective donors themselves have high blood pressure or diabetes or kidney disease themselves. But again, that's an area in which we can actually expand. We have actually altruistic donors now, individuals who don't even know the recipient, step up and actually, have given, life-saving, organ donation. There's something called a donor paired exchange program also. So if you have somebody who wants to donate to you but you're not compatible, there's a list of where they can actually give to somebody else who gives to somebody. Actually, there's a big circle where you could have 5 or more pairs that actually participate in this paired donor exchange program. So that's been around maybe 10 years or so. Yeah.
I remember a story on that.
Yeah.
Other questions? I didn't mean to hog the mic.
I work at several funeral homes, and I just want to encourage people, please get yourself ready to help people out. I look at so many people laying in that casket that had that opportunity, never did. So many cremations now. I guess my question is, when someone does die, do they have so much time for that organ to get to wherever it needs to get where it's useful?
All right. So we actually, there's something called a zero mismatch. Like we match according to 6 different categories, as far as the HLA, the tissue typing. And if you have a zero mismatch, we actually will fly organs across the country. And there are perfusion machines, been around maybe 30 years or so, but they're even better now, where you can, like in the case of kidneys or even livers, you can remove those organs from the donor and put them on a machine, and they're viable for like 24 hours or maybe 36 hours. And we have time to transport them to various places. The sooner you get them in, transplanted, the better. They're put on ice, but again, the longer they go, without being perfused, less oxygen, they're not oxygenated. And so yeah, generally you want to get them in within 24 hours. Yeah.
That's actually a good follow-up question.
Yeah.
So if on my license I do have the I'm a donor card, and say an EMT comes and I've been killed in an accident, is there some special action they would take to keep blood flowing in my body so that my organs could be harvested?
Yeah. So yeah, the ICU where you would be taken if they saw that you're an organ donor, they would, or even I mean, they would take you to an ICU, call Life Bank, and then Life Bank actually has a special team that comes out and manages the patients alongside the hospital nurses. But patients are primarily managed by Life Bank to keep the body perfused. You know, the heart is still beating in most situations. Those are called, heart beating. We do also some non-heart beating. Yeah, but there are ways to, to actually keep to keep the blood pressure, adequate that will perfuse the organs. The Life Bank would actually contact the family, contact the transplant team. There actually has to, in order to know where the kidney is going to go, because there's different programs at different hospitals, they have to look at the waiting list and look at the matching to see, which patients are in order. A lot of the patients who are at the top of the list don't necessarily, they may be in the hospital themselves. They may be it's called status 7. They may have a situation where they're not active on the list. Then we have to go down further on the list to see who's going to be the recipient of those organs. So yeah, it's a whole process. Yeah.
Hi, I have a question here.
Yes.
On the waiting list, how is it determined who gets a kidney when? I mean, is it like regional or how does that work?
So it's generally regional, but it goes by your match. The match of the recipient and the prospective donor. But your position on a waiting list changes. It's not like if you're first or third, you're not always that same position. It depends on the donor kidney and how well you match up with that prospective donor. So, and then whether or not there's any zero mismatches. Like if you're in Cleveland and there's a kidney procured in Cleveland, you may have a perfect match in Pittsburgh or Florida or wherever, where that kidney may be actually transported. So there's a federal organization called UNOS, United Network of Organ Sharing, that manages all the transplant list across the country. And so whenever there's a donor, they run to see, what that tissue typing is to determine if there's a perfect match anywhere else in the country. If not, then it stays locally in the region. So in the region in Ohio, there's Cleveland Clinic, there's University Hospital, there's Ohio State, and Toledo has a program. I'm not sure if the program in Dayton is still active or not, and Cincinnati as well. So, yeah. So they have their own regions. If you're a individual who needs a kidney, a liver, you can't be on more than one waiting list in your region. For instance, you can't be on Cleveland Clinic and UH. You have to pick one or the other. But actually, you can go to a different region and get on several different waiting lists to increase your chances of being matched with a kidney. Yeah.
Mike's right behind you.
I don't know how to diplomatically ask this, but I'll just say for someone who's old.
So I don't even see who's speaking here.
Are there any parts
still
usable?
No, I didn't hear the question.
Pardon me?
I didn't hear the question.
For someone who is old, let's say, are there parts still that are usable in transplantation?
So yeah, I mean, skin, tissue, eye, corneal transplants. Like I said, in certain situations, we'll put both kidneys from a donor into a single recipient. And we do that because one kidney from somebody who's older may not be satisfactory to get a person off of dialysis, so we have to put both kidneys in. So people of all ages can be donors. It depends on their overall health status. We measure their kidney function, things of that nature. There's no exact strict cutoff. I've seen kidneys donors probably up in their 80s, deceased donors in their 80s probably. Yeah.
Give it a shot.
Yeah.
Just again quickly, I see so many overdoses and suicides. When there's an overdose, are those drugs and that in your system negate be able to use those organs, or
No, not
what?
necessarily. I mean, there are tox screens that are drawn, and again, it's on an individual basis in terms of whether or not that individual would be a candidate. We're checking for infections, and a lot of times individuals who, not always, but who utilize drugs may have hepatitis and other infectious conditions. So we have to screen very closely for those as well. But again, like I said, this is an increasing problem that generally, I mean, you turn on it. How often do you hear about this on TV? Not very much at all. So yeah.
I have a question about race and how much does it make a difference in donations? So
it can make a difference, but because of the improved immunosuppressive medications, in most respects, it makes no difference whatsoever. So if you're white, you can donate to any, to blacks, I mean, so yeah, nowadays, because of the medication, it's not a huge factor. But we do, I mean, research has shown that if more African Americans would donate and be part of the organ donor pool, a lot of these minority individuals would, rise higher to higher ranks on the listing because of the HLA, the matching, genetic matching. So we still need more individuals to step up and be donors. Yeah.
I'll do this one right here. Have you ever had a donor then need themselves a transplant later on in their life?
So I personally haven't. I mean, I know that it's happened. And then, like I said, they actually will go to the top of the list. And again, and it's very rare because we're very careful in terms of evaluating prospective donors. When I was in training, if anybody had any hint of hypertension, high blood pressure, then we would exclude them. But now, actually, just having essential hypertension that's controlled on 1 or 2 medications is not a contraindication to being a living donor. And the other thing is, I didn't mention, so the recipient's insurance actually pays all of the expenses for the donor. And that's very, very important to communicate to society, because we don't want people thinking that they can't donate because they don't have insurance, But, and then the donors are followed for a number of years also by the transplant team, but also by their local private, primary care physicians. So yeah, that's a great question,
Yeah, I believe you said one of the most important things we could do is kidney disease prevention. And I'm just going to ask you, what's involved in that, and what education is there out there that could support to help with that?
So one of the, and so a lot of times there's no early signs or symptoms that an individual may have that may actually have high blood pressure or diabetes or even kidney disease. And so that underscores one of the reasons why we started this Minority Men's Health Fair, to provide access to free preventative health screenings, because a lot of individuals feel that if you don't have any pain, discomfort, swelling, shortness of breath, whatever it is, that they're fine. And that underscores the importance of getting a primary care physician, seeing them routinely, getting your blood pressure checked. One of the easiest tests to screen for kidney disease, diabetes, is a simple urine test. And we don't do it like in the old days where the doctors used to taste the urine. I'm glad we don't, to see if it was sweet. That was before my time. But a simple urine test can show whether there's microscopic blood. We call it hematuria. That could be a sign of early kidney disease. Could be other serious, conditions. It'll show whether there's, higher or glucose, sugar in the urine. It can actually show whether there's protein in the urine. It's a very simple, inexpensive test. Can be done right in the office. And I'm not sure how many physicians are doing it, but that's something. And the other thing is, a lot of work I do in the community is encouraging the community to ask questions. When you go in and see your physician, ask them, be prepared with a list of questions. And then, if they're not screening you for a particular, ask them, screen you, for kidney disease or diabetes or cholesterol, whatever it is. So, yeah, if we would practice more preventative medicine, we could prevent a lot of these cases of individuals, on the transplant waiting list. But I mean, there's not probably a month that goes by. I mean, even friends that I've known who are on dialysis, they had no idea that they had high blood pressure out of control. So yeah, I mean, it's a problem that we could potentially solve. Yeah. Yes.
Thank you for your talk. I'm curious about if there's particular programs that are effective in producing for underserved communities, in producing more doctors, healthcare professionals, either individual schools that have done this or maybe national, promotion, programs that have been successful.
And see, that's a very important question, and the reason why that's important, there's only 4% of physicians in America are African American, and I think that 6% Hispanic Latino, and it's not suggesting that every black person needs a black, I'm not suggesting that, it's impractical. But there is research that shows that if there's racial concordance, there's better quality communication and follow-up and compliance. Have you all heard of the Tuskegee syphilis experiment? And that actually has led to a lot of distrust that many minorities have when it comes to not only engaging in research trials, but even going to the doctor. So I know at Metro Health we have a program at Cleveland Clinic. We had initiatives to actually engage kids in high school or even middle school. Not to say you have to go into the health professions, but to at least them have start thinking about maybe being a doctor, nurse, scientist, researcher, that kind of thing. But it actually is very important. I know we have programs or collaboratives with like many of the HBCU, colleges and universities. But yeah, that's something that we need to do more work on to encourage the younger generation to consider the health professions. So, and actually, like I said, when we talk about health disparities, we're talking about conditions that burden predominantly minority percentages of the population. But the reasons it's important that we all become engaged in eliminating health, all sectors of society, not only health professions, but policymakers and others, because in the next 10, 15, 20 years, minorities are going to become the majority. So if minorities have a higher incidence of health disparities, lower life expectancy when they become the majority, how's that going to affect the entire country? Yeah.
Dr. Maudlin, how old or how long has a transplant that you did live? So someone lived 20 years post-transplant or 30 years, or what's the?
So me personally, or actually I haven't really calculated that out, or I haven't really followed up to see. So after a period of time, patients, a lot of times they don't see the transplant surgeon. They go back to their local nephrologist or primary care physician, and they don't really follow up at the transplant center. But actually, this past Sunday, one of my friends, a guy named Ron Kisner, he's a deacon at the Greater Abyssinia Baptist Church in Cleveland. He actually texted me and said it was his 8th anniversary from when I transplanted him. When he texted me, I was actually en route driving to the hospital for an emergency. So I said, well, I'm doing it again in 8 years later, but it wasn't a transplant. But yeah, so yeah, people will keep in touch with me, some people, and I'll be walking down the street and people say, oh, you did my transplant, So yeah, it's
Is there an average number of years though, nationally? Is there an average number of years?
Oh yeah, so if you have a living donor kidney transplant, the average survival of that kidney, that allograft, is about 21 years old, or about 21 years. If you're a recipient of a deceased donor kidney, it's about 8.5 years. And that just underscores, the benefit of getting a live donor transplant, living or non-related. Yeah. Yeah.
I just wish to make a
point about two things. One, in the questions that you were talking about, asking your general physician, one of the things to talk to them about are the side effects of the medicine that you take,
Right.
because there are a great number of them that have effect on your kidney function. Number two, I want you to all know, when my husband passed away, he was an organ donor, and I was visited by the director of the hospital when we were in the emergency room to validate the family's validation to the organ donation. So don't be surprised. It took me a little bit by surprise and made me feel very sad at that moment, but in the long run, it made me feel very good about it.
All right. Yeah. Yeah. Thank you for what you've done.
We've heard recent news articles about organ transplants from animals, specifically pigs. Is that a promising thing to reduce the number of people on the waiting list?
Yeah, there's been a lot of research. They call it xenotransplantation. There's really no success stories, in that area. A lot of it has to do with the fact that, well, incompatibilities, obviously, rejection, but also transmission of disease that, certain animals, certain species have. Actually, one thing they're working on is creating an artificial kidney, 3D printing, things that, yeah. So there's a lot of research out there. I don't know if it's ever going to come to fruition, but but research is very important. I mean, the immunosuppressive medications that we have it's based on decades and decades of laboratory science and research that actually was started not even for the purposes of these specific medications, but innovation builds upon innovation. So yeah.
Any other questions? This has been such a powerful presentation, so I really want to thank you for being here. And again, for all of you that sponsored and supported the Jake's Endowment to allow these programs to happen annually. But you're to be congratulated for the many great things you're doing in the Cleveland area and throughout your career. John, anything else I need to highlight? Great. Well, thanks for being here, and we'll see you next year for another exciting presentation.
Can I get a picture with the two of you? Thanks.